Hello buddies, I'm your engineer, MBA, and investor, and in today's video I want to talk about this X post that I just took a look at, and I was like, I think I should make a video on this because it talks about certain things that I've never really talked about in this channel, and specifically about Prime Medicine, but also relates to other companies. And I was like, you know what, although it is a little bit negative, a little bit pessimist, there's some truth to it. So let's take a look at it. And let's try to see what we can learn from it. So this person posted this on yesterday in the morning. I don't even know how to pronounce their full name. I mean, this is more for French name, Connoisseur. But anyways, I never really paid attention to PRME, which of course is Prime Medicine. But what the hell are these guys doing? First clinical indication is chronic granulomatous disease, of which there are approximately 18 US births per year. Oh yeah, and 25% are those caused by P47 PHOX mutation. So 5 patients per year, question mark. Then this person follows up by saying, why can't any platform technology be intelligent? We have companies like Intellia and Verve Therapeutics going after indications where we already have great drugs that don't require genome edits. A bunch of others whose strategies, we take quotation, we take CAR-T, and then we add CRISPR because reasons, end of quotation. And then companies like Prime Medicine are like, let's try to validate our technology in literally the smallest, least prevalent disease we can find. Our company has dominant IP position, and we ultimately expect all other players in the space to take license for their products. We are therefore going to burn all our cash in our product development on a third to market sickle cell disease and beta thalassemia. So this is of course Editas, and of course that was a joke, their last code. And then someone said, same issue with HAE, there are pre-existing drugs, and of course this is a reference to Intellia. Then CRISPR Tommy, which obviously is a big name in this space, says Prime Medicine is the only one that they could prove a POC, proof of concept, rapidly in patients. In reality, it is a company that went public, it appears, so it could profit massively, nearly instantaneously. The public markets are paying to do their preclinical work for years. Any decent lab could do this. That is what's going on with these guys, in my opinion. Okay, so lots of negativity here. Gene editing companies went public to enrich insiders. They're years away from POC. Should have stayed private. I'd stayed away from the whole lot. Okay. What are my thoughts here? Well, first of all, I didn't even know this, to be honest. I haven't really studied Prime Medicine that a lot. But to say that there's only 18 US births per year and 25% are actually caused by the mutation that happens to be what Prime Medicine is trying to tackle with their first indication. I think it's something to talk about, right? I mean, look, every patient matters, every single disease matters, right? No one is arguing that. No one's gonna like say that this disease doesn't matter, we shouldn't be tackling it. No one's saying that. But for a company to go private to public and to justify its valuation and to raise public money, you need to make sense out. You need to be viable, right, as a business, right? You need to commercialize this, and you're not going to be commercializing this with 5 patients a year. That's not going to justify any cost here. Obviously, Prime Medicine has a different play here. Their play is to prove that their technology works, so they can license out their tech to other companies, become the platform. Sort of relevant to similar rather to what Beam Therapeutics are doing, but the difference is Beam Therapeutics, their Beam 201 program is actually tackling sickle cell disease, which there happens to be a lot of patients for that. So there's still a business with their leading program as per se. The person saying the same for NTLA, and that person also, the other person, the author of this thread, saying that NTLA is doing something similar, right? Where we have great drugs for NTLA 2001, 2002 diseases that they're tackling respectively. That is wrong. HAE has no cure. Now, there are things to minimize the pain. There are things to cope with the pain. There are things to cope with the disease, rather. But there's no one-time treatment cure. And NTLA is obviously doing that with both of their programs respectively. So to say that it's the same issue here by Raj here, their pre-existing drug, this is false. Now, if you're talking about Verve Therapeutics with heart disease, then why is heart disease the leading cause of death in America? I mean, guys, like, this is not rocket science, right? I don't think what's happening with Prime, you can apply that with every single CRISPR company. Editas is a different beast. I would never put Editas in the same breath as companies like NTLA, CRISPR Therapeutics. I think Editas is in its own bubble, and I would not even talk about it, comment on it. But if you want to talk about Editas, just make a separate thread and just talk however you want. I actually happen to agree with most naysayers on the company. I think they have bad leadership. I think they've executed poorly. One of the oldest companies in the CRISPR landscape, yet one of the worst companies due to failure to execute. But that's a separate topic for another day. Going back to this topic though, Prime Medicine, this is alarming, right? The fact that they're only, their sample size per year happens to be just a few in the US. Now, obviously, there's other people around the world, but we all know that, the US market matters. This is where it's going to start. And to say that you only have 5 patients a year, I mean, maybe this is an exaggeration, maybe there's a little bit more than that, but just a dozen, it'd still be bad, right? The Dr. Yurnov here said what Prime Medicine is doing exactly right, using a small indication to build a platform to treating other diseases. And NTLA has done this very well. Prime will leverage non-clinical and CMC from CGD to under INDs. CRISPR is a platform for it. So you see both sides of the arguments. The only thing I disagree, again, I don't know why NTLA is being bundled in this. HAE has thousands of patients, right? Let's take a look at this. I mean, I wanna show you guys this. This just doesn't make sense to me with people saying the indications low. Look at this disease here. Just with ATTR, that's their first leading program that they've gotten successful data that we have all reasons to believe the FDA at least is going to prove it. Worldwide, there's about up to 500,000 patients. That was a stat from 2021. The number has grown, obviously. You don't need a rocket scientist to know that, right? And you look at the other program, that's 50,000 patients worldwide. That's not 15 patients in the US, right? That's going to be at least 100/1,000 patients. That's a difference, right? There is a difference there. There's a huge difference between 15 patients and in the hundreds, right? You're not talking about multiple X, right? You're talking about, dozens of X more, right? So that's not the same thing. So I don't know why NTLA is getting bundled here. And again, there's no treatment for these two diseases. So I still don't understand why NTLA is being bundled in that same discussion, even by Dr. Yurnov, but I digress. Look, Prime Medicine, the fact that they're only tackling this small sample, I think their plan is to become a platform, license their tech out. They have a different approach than these companies like CRISPR Therapeutics and NTLA. But for the person in that thread saying that these companies went public too early and so on, look at the FDA approving CRISPR Therapeutics. That is not a one-off. We are going to get other companies like NTLA, Beam Therapeutics, Caribou, to get their programs approved in the next 3, 4, 5 years, and then multiple clinical trials, right? Just like we talked about in yesterday's video, the future of applications, are there, and the future is to get multiple of these clinical programs in the same company approved, right? And to say that, to basically be negative about this program because of what Prime Medicine is doing for their particular indication. I mean, Prime Medicine went public early, in my opinion, and I can understand the scrutiny around it. But to say that these companies went early, like CRISPR Therapeutics, that actually can now commercialize as of almost 2 months ago, their program over 2 months ago at this point, I think that's a red herring. I think that's a far stretch argument. I think that's misleading, and I think people should get back to the basics here and not start scrutinizing the whole space because of maybe Editas or because of maybe Prime Medicine. I think there's still some amazing companies in this space. And I think it's quite unfortunate that NTLA is getting bundled in the same story as Prime Medicine. I don't see how 15 patients in Prime Medicine's leading program is compared to 500,000 patients from NTLA's leading program. And that's their first program. They have actually another leading program with about 50,000 patients around the world. So I just don't see how this is comparable. And by the way, this is fully owned. I want to remind viewers this is fully owned. They can actually partner it with another company and get maybe $1 billion, maybe $2 billion up front, or maybe with milestones involved, commercializing milestones. It's a whole different story, right? So let's not mix and match here. These are all CRISPR companies. They're all using different technologies, but they're all different companies, different management. I'll leave it out like that. So hopefully you guys appreciate this video. As always, subscribe if you're not. Like this video, guys. Do like it. It does help the channel. It does help the videos get across other YouTube homepages. So do like it. Smash it. It's free. It's easy. It's quick. It's just underneath this video, guys. Do like it. And let me know in the comments, guys. What do you guys think about Prime Medicine? What do you guys think about that X poster? Let me know. I'll see you guys in the next video.